I know this sounds scary and overwhelming, but here are a few tips that you can follow to prevent asthma flare-ups, especially during monsoons. To reduce the humidity inside the house, one, you can try and use dehumidifiers. Two, make sure if the patient is asthmatic, do not dry wet clothes inside their room. Make for different arrangements, dry them in the machine or a dryer, how much ever it's possible. Before the rainy season, you can get your ducts, AC ducts checked and clean for any molds or funguses that have been growing in there. If you are someone who frequently gets respiratory infection, it will be worthwhile to check your vitamin D level and take the supplements if required. I am sure your pulmonologist would have discussed the recommended vaccines that are there for asthma patients, especially in the younger children and the older age group. And if you are someone who gets frequent respiratory infection, taking the flu vaccines before the rainy season is always recommended. You would have been given a peak flow meter to regularly monitor your asthma and peak flow at home, and a reduction in the PEFR value really helps you identify a major exacerbation or a flare-up. And the moment you see that there is a reduction in the peak flow readings, you can change your treatment accordingly, which is as per your personalized asthma action plan. Now, lastly, I would like to point out that if your asthma has been in control and you've been regularly visiting your doctor and taking the medications, inhalers as per protocol, there is less chance that your asthma will flare up. And even if it does, it is very important to understand that worsening of your asthma symptoms during monsoon is a part of worsening of the disease. So a simple cough syrup and antibiotics and medications are not always indicated. Please get in touch with your doctor to understand how to manage your asthma exacerbation. Sometimes just increasing the dose of your inhaler or taking the rescue inhaler as and when needed does the job. Sometimes you may need oral steroids. So please understand how severe your disease is, how severe the exacerbation is, and you can prevent a life-threatening event.